There's a liquid that comes out of your body during arousal. It's not semen, it's not urine, and it's telling you something about your health that you've probably never thought to ask about. I'm Dr. Rachel Ross, physician and sexologist. Today we're talking about pre-cum, what it is, where it comes from, and what it means when you see it, and something that nobody else is telling you, the difference between healthy pre-cum and something that looks similar but is actually a warning sign. Plus, I'll answer the question I get asked more than anything. Can I get her pregnant? Let's get into it. So pre-cum, or pre-ejaculate, if we're being clinical, is a clear, slippery fluid that shows up during sexual arousal, usually after an erection starts, but well before ejaculation. It's not semen, it comes from a completely different source, and it's not something you control. It happens on its own, sometimes multiple times during arousal, and some men don't even know it's happening. Now, the amount varies a lot. Some men produce a few drops, some produce up to a teaspoon, and that variation is completely normal. So where does it come from? Now, you've got a pair of tiny pea-sized glands called Cowper's glands, also called the bulbourethral glands. They sit just below the prostate and connect to the urethra or the pee tube through small ducts. Now, here's what's interesting. Women have the equivalent of these glands. They're actually called the Bartholin's glands, and they do a similar job. So this isn't just a male-only system, it's a human arousal system. What pre-cum actually does, though, 3 jobs. 1, lubrication. It coats the urethra to make the passage of semen smoother during ejaculation. 2, neutralization. The urethra is the same tube that urine passes through, and urine is acidic. Pre-cum is alkaline. It neutralizes the acidity so that when sperm eventually comes through, they're not swimming through an acid bath. Protection. It creates a safer environment for sperm survival, not just in the urethra, but also as it enters the vaginal canal. So think of it this way. Pre-cum is the advanced team. It shows up before the main event to clear the path, neutralize the threats, and make sure everything is ready to go. It's like the crew that comes out before a concert, right? They set up the stage, they test the sound, they make sure the lights work. The audience never notices them, but without them, the show doesn't happen. Now, here's something you've likely never been told, and this is the part that we want to talk about. Pre-cum is the green light signal, and here's why. See, the Cowper's glands are activated by the parasympathetic nervous system. That's your rest, relax, and arousal system, the same system that drives step 1 and step 2 of what I call the erection cascade. You can watch that video, save it, and watch it later. So when pre-cum shows up, what your body is telling you is, my parasympathetic system is online. I'm in arousal mode, not stress mode. The nerves are firing, the glands are responding, the blood flow is active. Pre-cum is your body's way of saying the system is working and we're ready to go. Now, when the pre-cum is absent or when it's significantly less than it used to be, that can sometimes be an early sign that your arousal response isn't as strong as it used to be. Now, it could be dehydration. It could be you're not as aroused as you used to be. It could be age-related changes to the glands, or it could mean that your parasympathetic nervous system isn't dominating the way it should in intimacy, meaning your stress is winning. Now, let me be clear. Low or no pre-cum is not a medical emergency. It doesn't affect your erection, your fertility, or your orgasm, but it is a data point. And if you're paying attention to your body, which you should be, it's data or information worth noticing. And if you're starting to wonder about the overall well-being of your erection, not just one signal, but the whole system, take my free e-age erection quiz. The erection has an age, and your erection may be getting older or aging faster than you are. It's a 90-second quiz, and you'll get a customized report on both your e-age and your blueprint for optimization. It's a proprietary quiz created by me, so use the link in the description or scan this QR code to calculate your e-age. It's free to you, and subscribe to the channel. It keeps the channel going. Now, I just told you what healthy pre-cum looks like and what it signals, but there's something that's like pre-cum, but it's not the same thing. And if you're confusing the two, you could be missing warning signs that involves your pelvic floor strength and your prostate. Plus, I'm going to answer pregnancy questions. So there's a difference between pre-cum and leakage. They can look similar, they can show up at the same times, but they're not the same thing. And you got to understand the difference. See, pre-cum is clear, slippery fluid produced by the Cowper's glands during arousal. It's intentional. It's functional. Your body's doing what it's supposed to do. Now, leakage is different. Leakage is fluid, sometimes clear, sometimes cloudy, sometimes with a milky quality that shows up when it shouldn't. Outside of arousal, during a bowel movement maybe, or when you're straining, or when you're sitting too long, or as a slow, consistent drip, that just doesn't seem connected to anything sexual at all. See, when fluid is leaking outside of that arousal window, your body is telling you something, and it usually comes down to one of four things. One, pelvic floor weakness, your pelvic floor muscles, the ones that sit at the base of your pelvis and support your bladder, your bowel, your erection. They're supposed to act like a gate. They open when it's time and they close when it's time. Right? And when the pelvic floor is weak, the gate doesn't close all the way, and fluid, whether it's prostatic fluid, seminal fluid, or even urine, can leak through. And if you're not aroused, it's kind of a structural issue. And here's the thing. The weak pelvic floor doesn't just cause the leakage, it affects the erection quality, erection force, the ejaculation force, the bladder control. So if you're seeing leakage and your erections aren't like they should be, then your pelvic floor is an issue. Prostate congestion or weakness, number 2. Now, the prostate produces fluid consistently. There will be a buildup if there's infrequent ejaculation, chronic inflammation, poor circulation, stagnant fluid. That fluid has to go somewhere, and sometimes it leaks. An enlarged prostate can also push on that P-tube and create a slow drip of fluid that has nothing to do with being aroused. This is different from pre-cum. This is congestion most of the time from having an enlarged prostate. Some men notice it after sitting for long periods of time, or during exercise, or laughing. The prostate is telling you that it needs attention. Number 3, congestion from infrequent ejaculation. If it's been a while since you've ejaculated, and I mean a while, those seminal vesicles and the prostate will become backed up, and that pressure can cause the fluid to seep out. When I was a prison medical director, there was so many complaints of leakage from a stagnant sexual system because they weren't getting any. This form of leakage is different. It's releasing because the system is backed up. And if it's happening to you and you're capable of it, it's a sign that your body just needs a release, or that circulation or in the pelvic region needs to be improved. That's where prostate massage can come in. That's where that tennis ball trick we talk about can come in. The next is a sexual transmitted infection. So how can you tell the difference between pre-cum and leakage? Here's a simple way to think about it. If it's showing up during arousal or with an erection and it's clear and slippery, then it's likely pre-cum. Body's doing what it's supposed to be doing. If the fluid is showing up outside of arousal, maybe during a bowel movement, after sitting for a long period of time, random throughout the day, it's cloudy or milky or colored, that's leakage, and it's pointing you towards the pelvic floor, your prostate, congestion, or infection. Your body's asking for help. So if it sounds familiar, don't panic, but do pay attention, because it's usually very fixable. So head to your doctor. Make sure it's not a sexually transmitted infection, and then you can work on fixing the root cause. Pelvic floor strengthening. Start with the pelvic floor. The same muscles I teach you to activate when you're doing a dick-up. These are the muscles that close the gate. Strengthen them, and leakage will resolve on its own. Prostate health. Get your prostate checked, and not just for cancer, but for enlargement, inflammation, and overall function. A healthy prostate doesn't leak. Ejaculation frequency. If you've been doing long stretches without ejaculating, your body may need a regular release to reduce some of that pressure. The Tao of Sexology has a way of helping you find your frequency based off of your age and your body. Next is movement and circulation, walking, stretching, prostate massage, sitting on an erection activation cushion so that you're practicing activated sitting, activating your hips, getting them mobile. And this is where an activation cushion comes in. I'll put a link in the comments below. Now, we cover it all here. It's just an honest place to get all natural sexual health information. So subscribe, turn the notifications on, because this is what we do here. We teach you things about your body that nobody else wants to talk about, and take an all natural approach. So subscribe. All right. Question I get more than anything. Will pre-cum get someone pregnant? The answer is yes, it's possible, but the real answer is more nuanced than a simple yes or no. See, pre-cum itself doesn't have sperm in it. Cowper's glands don't produce sperm. Sperm is produced in the testicles. But if a man has recently ejaculated, there may be residual sperm in the P-tube. So sperm can have been sitting in the urethra, especially if you have super sperm hanging around there. You know if you have super sperm or not. And that pre-cum can come through the same tube and pick up that leftover sperm and carry it. Now, there's a myth that if you urinate after you ejaculate, it's just going to flush out all the remaining sperm. Well, it helps because urine is acidic and it can wash away most of what's left, but studies have shown it doesn't guarantee that the urethra is completely sperm-free. Some survive it. So this is why the pull-out method is not really a reliable form of birth control. Research shows that with typical use, It has a 1 in 5 failure for pregnancy. 1 in 5 may seem like a small number unless you're one of those 5, right? And even if you think you're pulling out on time, pre-cum has been flowing the entire time you've been aroused. You can't control when it comes out or how much of it, so the exposure is happening before you even get to the decision point. So if you're relying on the pull-out method as your primary form of birth control, understanding that pre-cum has been entering the equation from the very moment of penetration, it's not just when he finishes, the fluid has been there the whole time. And one more thing that has to be said, pre-cum can carry sexually transmitted infections, HIV, gonorrhea, chlamydia, herpes. All of these have been found in pre-ejaculate fluid, but there's usually less of it. So even if he doesn't ejaculate inside, the exposure can occur through pre-cum. It's not as likely though. This is why condoms are so important, even if it's just the tip. So let's bring this full circle. Pre-cum is not random. It's not a mystery. It comes from specific glands. It does a specific job. And when it shows up during arousal, that's a green light, system is working. But if fluid is showing up when it shouldn't be, that's not pre-cum, that's leakage. And that's your pelvic floor, your prostate or congestion talking. So pay attention to the difference. And as for pregnancy and sexually transmitted infections, pre-cum may not carry its own sperm, but it can carry what's been left behind in the P-tube. So protect yourself accordingly. This is body literacy, knowing what your body is doing and why. And now you know. Now, in order to get the full picture of sexual health, watch this video next. I'm Dr. Rachel. I love you. And boom, watch this video right here.